Okay, so you're getting ready for that big family nurse practitioner interview. Huge moment, right? We're diving deep today into Indeed.com's guide, Family Nurse Practitioner Interview Questions with Answers
Mm.
to help you really nail it. It's not just about having those perfect answers, though. We're going to go deeper and figure out what those questions are really trying to tell us
Hmm.
about what being an FNP is really all about so you can show them you've got exactly what they're looking for.
It's really fascinating how much this guide emphasizes all the different skills you need. I mean, of course, medical knowledge is a given, but it goes way beyond that. They
Yeah.
want to see you're a great communicator,
Yeah.
that you can handle pressure, that you have real leadership qualities. Even ethical decision making is in there.
So it's more than just knowing how to treat illnesses. It's about navigating that whole family dynamic, right?
Yeah.
They even mention specializations, like pediatrics or geriatrics. Makes you realize how many different paths you can take as an FNP.
Exactly. That whole family approach is key. It's not just about the individual patient. It's understanding how all those family relationships affect health and well-being. And think about the communication skills that takes. Explaining complicated medical info to a worried family,
Hmm.
promoting healthy habits, maybe even helping family members through tough conversations.
Yeah, and we can't forget about working well with a whole healthcare team. This guide really stresses how important communication is. It seems to be everywhere. Like they even have an example about having to explain a whole new electronic health records system to your whole team.
Right, and that's not just about understanding the technology, it's about leading that change, getting everyone on board, and making sure the transition goes smoothly. That takes some serious communication skills.
It makes sense when you think about it. Family health issues can be so emotional. Building that trust and rapport through clear communication is crucial. Like, I remember when my grandmother was ill.
It really is about more than just conveying information. It's about making that human connection. Which brings us to another crucial skill the guide highlights. Handling those tough situations, the real-life scenarios you're going to face as an FNP. Like, how would you answer a question about how you respond to pressure or how you give bad news?
Oh, I was just getting to that. They even ask what you do if a patient wanted a treatment that their insurance wouldn't cover.
Yeah.
Talk about a real ethical dilemma. It's not always so black and white.
Exactly. These questions are meant to see more than just what you know. They want to see you use critical thinking, how you approach those difficult situations, and if you're really committed to putting the patient's well-being first.
The sample answers they give are really great. But I think what I like most is that they don't pretend these situations are simple. It's not about having all the answers. It's about showing you have the right mindset and approach.
It's about showing you really understand all the little things about family practice, the ethical parts, and the systems you'll be working within. It's that deeper understanding that really makes FNPs different. And speaking of what sets FNPs apart, the guide actually addresses a pretty common question. What's the difference between an FNP and a registered nurse? This is where the extra training and education really come in.
That was really helpful. I've always wondered about this specific. So an FNP has that extra knowledge and expertise that lets them diagnose,
Yeah.
treat, even prescribe, basically acting as a primary care provider for a whole family.
Exactly. Think about how much wider that makes your scope of practice. Remember that example we were talking about?
Yeah.
About taking the lead on a new electronic health record system? That kind of leadership potential is a big part of being an FNP.
It really makes you realize an FNP isn't just providing care. They're shaping healthcare systems
Yeah.
and advocating for their patients at a higher level.
Speaking of advocating for patients, let's get into some of those interview questions about handling those difficult situations. This is where you can really show off your communication skills and your ability to navigate those tricky family dynamics.
All right, bring on those tricky scenarios. I'm ready to see how we can create some responses that highlight those crucial skills and help you really shine in that interview. Okay, so let's dive into some of these challenging scenarios that they might throw at you in the interview. The guide mentions this question about what you do if a patient asks for a treatment that their insurance just won't cover. Talk about a real ethical dilemma.
Oh, yeah, that's a tough one. It really puts you to the test. Trying to balance what the patient needs with the reality of how the healthcare system works. You want to do what's best for them,
Right.
but you also have to work within those insurance constraints.
Right, and you definitely don't want to make promises you can't keep. The guide suggests being really open with your communication, explaining the situation clearly, exploring other treatments that might work, maybe even helping them figure out how to appeal to the insurance company.
It's about being there for them as a resource and an advocate, even when you can't give them the news they want to hear. This kind of scenario really shows how important it is for FMPs to have clear and empathetic communication skills, especially when dealing with these sensitive topics.
For sure. Another tricky question they bring up
Is it?
is about disagreements with doctors or other providers. Obviously, teamwork is so important in this field, but let's be real. Conflicts happen. How do you show them you can handle those situations professionally?
It all comes down to showing off those conflict resolution skills. They want to see that you can respect different points of view,
Yeah.
that you can communicate clearly even when you disagree, and that ultimately you're putting patient care above everything else.
Yeah, the guide talks a lot about active listening, focusing on the shared goal of patient well-being and feeling common ground. It's not about winning an argument. It's about working together to find the best solution for the patient.
What's interesting here is that being able to handle these disagreements well also ties back into leadership. It shows you can navigate those complicated team dynamics, advocate for your patients, and still keep things professional and respectful.
Definitely. Because this next question is really interesting. Have you ever faced an ethical dilemma in your practice? How did you handle it?
Hmm.
So it's one thing to know those ethical guidelines, but they want to know you've actually applied them in real life.
This is your chance to show your integrity and your commitment to ethical practice. It's not just about knowing the rules. It's about showing them how you think things through, how you make those tough decisions, and how you seek guidance when you need it.
The guide doesn't give a specific example, but it emphasizes how important honesty and transparency are, and seeking advice from more experienced colleagues or mentors. It's recognizing that you don't always have all the answers yourself, and knowing when to reach out for support.
And that highlights another really important part of being an FNP, lifelong learning. Healthcare is constantly changing, and ethical dilemmas can be incredibly complicated. You need to show them you're willing to learn, adapt, and get a guidance when you need it.
So we've covered some of those tough ethical scenarios,
Mm-hmm.
but let's switch gears for a second to a question that's a bit more personal. What interests you most about our healthcare facility? Seems pretty straightforward, but I think this is where you can show them
Yeah.
that you've done your homework and that you're genuinely interested in them.
This is your opportunity to stand out. Show them you're not just looking for any FNP job. You're looking for the right fit. Do your research. Check out their website. Read about their mission and values. Look for news articles about what they're doing.
The guide suggests pointing out specific programs or initiatives that you really connect with, or maybe something you learned about their approach to patient care. It's about showing you see yourself as part of their team, not just someone filling a spot.
It's about aligning your values and goals with theirs, showing them you're really invested in what they're all about. Think of it like this. You're interviewing them just as much as they're interviewing you. You want to make sure it's a good fit for both sides.
Okay, so we've talked about a lot, broken down those difficult questions, and highlighted the key skills and qualities they're looking for. But how do you take all this and actually turn it into interview gold? How do you make those responses stand out and really show off your unique experience?
That's what we'll get into in the final part of our deep dive. We'll go beyond the general advice and really get into the details of how to tailor your answers to make a lasting impression.
Okay, so we figured out what those interview questions are really getting at, those core skills and qualities that make a great FNP. But now let's talk about you. How do you take all this knowledge and turn it into answers that really show off your unique experience?
That's the fun part. It's about going beyond those generic answers and really bringing in your personality, your passion, those moments that make you stand out. Remember that question about promoting healthy lifestyles? Don't just list things like exercise and nutrition. Think about things you've actually done.
So like if I volunteered at a health fair or led a community fitness group, I should mention that.
Exactly. It shows you take initiative, that you're committed to this stuff, even outside of work. It's not just I educate patients. It's I'm so passionate about this that I volunteered to help even more people.
That's so much better. What about those questions like, how do you handle pressure? Or how do you deal with difficult family members? Those feel tough to answer without sounding generic.
Specific examples are your best friend here. Think back to your clinical rotations, volunteering, even personal experiences. Was there a patient who went into cardiac arrest? Did you have to help a family through a really tough conversation? Those stories really bring your skills to life.
So instead of just saying, I stay calm, it's more like, during my rotation, a patient went into cardiac arrest. I immediately followed ACLS protocol. Oh, and for anyone listening who might not know, that's advanced cardiac life support. Anyway, I followed that protocol while staying focused. and help to stabilize the patient.
You're painting a picture for them. And remember, leadership comes in all shapes and sizes, not just big projects. Did you mentor other nurses, improve a process? Those are great examples too.
So if they ask about leadership, I could say something like, when I was working in the cardiac unit, I noticed the discharge instructions were really confusing. So I took the initiative to create a simplified version. I worked with the nurses and doctors to make sure everything was clear.
Exactly. You're not just following orders, you're making things better. That's what they want to see. It's about making those connections between the questions they ask and your own experiences, how you communicate, how you solve problems, your approach to ethical situations.
It feels so much less like I'm memorizing answers and more like I'm showing them who I am as an FNP.
Exactly. Now, as you're prepping for that interview, here's a final thing to think about. How can you weave your personality, your values, your aspirations into those responses? What makes you the FNP they need on their team?
That's such a good question to consider. It's not just about getting the job, it's about finding the right fit, a place where you can really thrive
Yeah.
and make a difference for families.
We definitely encourage you to check out the full Indeed.com article. It's full of even more great tips and sample questions. And remember, the more you practice, the more confident you'll be.
You've got this. Go out there and rock that interview. We're all rooting for you.